guess I could do that.
Okay, so large intestine, meridian of the hand yang ming, starts at the end of the radial side of the index finger at large intestine 1. Continues superiorly and passes between the first and second metacarpal bone through large intestine 4, which is the entry point, and continues through the rest. Ascends the posterior margin, posterior, the anterior, posterior margin of the forearm along the radius to the lateral edge of the transverse cubital crease of the elbow, LI11. Continues superiorly across the upper arm to the shoulder through LI15. Continues posteriorly and medially over the shoulder, crossing the small intestinal channel at SI12. Then connects with due 14 at the lower border of the 7th cervical vertebra. From due 14, the channel continues over the shoulder to the supraclavicular fossa, stomach 12. Descends to connect with the lungs, its paired organ, and then continues inferiorly through the diaphragm to enter the large intestine. From stomach 12, a branch ascends the neck along the sternocleidomastoid muscle, the SCM, that's the LI 17 and 18, traverses the cheek, stomach 4, enters the lower teeth and gums, REN 24, curves around the upper lip to the philtrum, due 26, and the channel then crosses the center line of the body to end up on the opposite side at large intestine 20. Large intestine organ pathology includes diarrhea, dysentery, epistaxis, watery, nasal discharge, toothache, congested and sore throat, borborygmus, which is sounds the guts make, and abdominal pain. Large intestine pathway is a pain in the neck, anterior part of the shoulder, anterior border of the extensors of the upper limbs. So then LI1, we mentioned before, is on the radial side of the index finger, just as you would extend out the little corner of the nail, and is premier point for sore throat. It's not needled often, but for sore throat, you combine it with lung 11, bleed out a few drops of blood, and immediately it feels better. It's amazing because it clears heat. It's a metal point and a ting well point, like the first trickle, the first little well, the first little arising of the large intestine meridian. Li2 on the radial side of the index finger, distal to the metacarpal phalangeal joint at the junction of the red and white skin. Point is located when the finger is slightly flexed. Three is on the proximal side of the knuckle, and 2 is on distal side of the knuckle. All on the radial side of the metacarpal phalangeal joint. That's knuckle. The distal side of the metacarpal phalangeal joint. The proximal side is LI3. Li2, not used that often, but it is a sedation point and it clears heat. Good for blurring of vision, coughing blood, toothache, sore throat, and fevers. And similar indications with Li1, fevers, sore throat, toothache. Especially the lower gums, because they said how the large intestine goes in.
Oh yeah.
Large intestine meridian goes into the lower gums. Li3 is a wood point and a shoestring point. And when a loose fist is made, the point is on the radial side of the index finger in the depression proximal to the head of the second metacarpal phalangeal joint. Toothache, sore throat, redness, swelling of the fingers, and the dorsum of the hand, because it expels interior wind and clears heat, brightens the eyes, benefits the throat. Not used that often, but here's a super whoop point used so often, so beneficial. Li4, Hagu, the joining valley, is the yuan source point, the entry point, and the 4 command points of the face and mouth region. Because it, big time, moves the chi, stops pain. It's located on the dorsum of the hand between the first and second metacarpal bones, approximately in the middle of the second metacarpal bone on the radial side. So it's that little pocket underneath there, right under the bone. And it's usually sore in most people. It's a little tender spot. But so useful, so powerful, it's used every day in clinic. For headache, pain in the neck, or any part of the body, redness, swelling, pain of the eyes, epistaxis, nasal obstruction, rhinorrhea, toothache, deafness, facial swelling, sore throat, because it dispels exterior wind, releases the exterior, stimulates the dispersing function of the lungs, because it's the paired organ with lungs. It's got more power over the lungs than a lot of the lung points. These kind of wimpy other secondary lung points we pass up. And if someone's getting a cold, Li4 and lung 7 on both sides will kick it out very quickly. Stop the duration of a cold. If they're just coming down with it and you need Li4, lung 7, and leave them down for just the minimum, just 30 minutes, and get them up, then the cold's gone. Removes obstructions from the channels, tonifies chi and consolidates the exterior, stimulates the dispersing functions of the lung, like we were saying, and stops pain. Harmonizes ascending and descending function, frees the channels, quickens the connection vessel, courses wind and resolves exterior, discharges lung heat, frees gastrointestinal downdrain, relieves pain, quiets the spirit. If you combo it with liver 3, we haven't met yet, but it's almost a similar location. You have this one in that web of the joint, and liver 3 in the web of that joint on the foot. Then you have the 4 gates, the famous 4 gates, which moves the liver chi and makes a big stress relief in people.
On both sides.
Yeah, 4 gates. You do those all around. That was like the first treatment. I was like, wow, I can really feel this. They did the 4 gates. I'm a stressed out student learning all this stuff with a little family on the way. Put those in there and you're like, ah. It all relaxes. Very important. It is contraindicated during pregnancy.
What's that mean?
contraindicated. Don't use it during pregnancy
Okay.
because it has this descending function, and everything pregnancy is keep it all in.
Mm-hmm.
Don't move the chi. In a way, it's pregnancy is a stagnation condition. They got to hold the baby in. So it is used for stimulating labor. Initiating labor is a mysterious thing, but if mom is already in labor and it's kind of puttered out, I've done this a couple times. You needle it and then let them rest. Sometimes the contractions slow down because their mind is settled while the needles are in. Again, just 30 minutes or even less, just a little bit, take them out. Then bam, the contractions come back much stronger, and they don't have to transport it. Don't go to the hospital, they can have the baby at home. That's how we've used famous Hegu Li4. Really beautiful point. Years before I even thought about Chinese medicine, I was on this plane going back to Kansas City, and there was a guy sitting next to me. He had a bad headache. And I said, and just out of the blue, I was like, "Here, let me help you with that." And I started to squeeze on that point. I think I had read some acupressure book that said, "Oh, this is the point for headache." And sure enough, it is. It does. Takes out excess conditions in the head. So I just held that point for about 30 seconds on either side. And he's like, "Yeah, my headache feels better." That might have been part of it planting the seed in me for Chinese medicine. Puncture perpendicularly from 1/2 to 1 inch. It can go quite deep there. But you don't have to stimulate it too strong because it is a strong point. There's some points that just grab and you feel it right away. Li5 is in the Anatomical Snuff Box. All those proper gentlemen were using this as their snuff box. Okay, whatever. It gets that name. On the radial side of the wrist, when the thumb is tilted upwards, it's the depression between the tendons of the muscles, extensor pollicis longus and brevis. Longus and brevis, the two tendons. In between them, you have Li5, which is a nice releasing exterior and taking out fire point, and used very commonly for skin problems. Famously for like insect bites, itchy skin, hot skin, anywhere on the body, that was one to consider. Li6 is the low connecting point when the elbow is flexed. The radial side of the arm upward, the point is on the line joining Li5 and Li11, which we'll meet soon, 3 sun above Li5. So it's just kind of up there, a little bit past lung 7. Opens the lung passageways and regulates the waterways. For edema problems, edema is water under the skin. Water under the skin, the face is puffy. Honey, you look puffy today. Oh, okay, let's needle large intestine 6. Oh, I feel better. Two up from that is Li7. Clears heat, stops pain, expels wind, benefits the throat. We're all on a line going up to Li11. Where's Li11? It's where we found lung 5 earlier today. We found lung 5. On the outside of the tendons. Go bend it a little bit, and you can dig in. You can feel the tendons. You go. That was our famous lung 5, and then there's the elbow. Halfway between there is LI11, and we haven't met that yet. But all these points are measured like towards it, so you see the line. That's where we're headed. We'll talk about it shortly, because these other ones aren't so important. But we have to know the location. 4 Sun below LI11 is LI8. Ooh, that's good. I feel good. That one feels interesting. Dissipates wind, clears heat, frees the channels, relieves pain. They're using that for pain in the elbow. So a little bit, yeah, you find that little achy spot in there. LI9 is just one up. LI10 is another one up, so it's 2 Sun below LI11 is large intestine 10. And that one's used pretty often for removing obstructions from the channel, arm pain locally, but also abdominal pain, diarrhea, toothache, swelling of the cheek, motor impairment of the upper limbs, pain in the shoulder and back is what it's considered. These ones you can needle pretty deeply. 1 inch, 0.2 is the maximum depth. And then famous LI11 is a very, very often very beneficial point. It's a tonification point, but also heat clearing. So remove exterior wind heat, like that whole cold and flu thing. If it's a hot problem, if they have a cold problem, maybe not so much. If they have a hot problem, then we always are going to include large intestine on 11 to take out the excess heat, because it cools and regulates the blood. It's good for skin problems, so it goes together with LI5 for treating eczema, rashes, and things like that, hot problems on the skin. And I'll repeat the location when the elbow is flexed. So you find the point with the elbow flexed a little bit. It's the depression at the lateral end of the transverse cubital crease, midway between lung 5 and the lateral epicondyle of the humerus. Otherwise known as the elbow bone. Sore throat, toothache, redness, and pain of the eyes, urticaria, motor impairment of the upper skin, diarrhea, hot diarrhea, and fevers, things like that. Cools the blood, clears heat, relieves the exterior wind, and regulates the nutritive chi in blood. Benefits the sinews and joints. Classically, how it's used. 1 Sun up from that is 12, usually for pain and contracture of the elbow and arm, not used too often. On the medial border of the humerus. Large intestine 13 is 3 Sun up. Watch out for the artery if you go deep.
Well, I feel it like similar how like a tender spot. Is that
Yeah.
could that be the artery or the point? Right here.
Yeah. A bit of both. Superior to the lateral epicondyle of the humerus, on a line joining LI 11 and LI 15. We'll meet LI 15 shortly. 3 cent up from LI 11. LI 14 is on a line joining those 2 points, LI 11, LI 15, 7 cent up on the radial side of the humerus, superior to the lower end of the muscle deltoideus. So right where the deltoid comes down, it's right above. Pain in the shoulder, rigidity of the neck problems. Resolves phlegm, brightens the eyes, clears the channels and the vision. That's really tender with me. I can probably use that one needled. That's quite tender. LI 15 is a famous point for shoulder problems in the Michael Turk tradition. Anterior, inferior to the olecranon on the upper portion of the muscle deltoides. Deltoid on the bottom is 14, on the top is 15. When the arm is fully abducted, the point is in the depression appearing at the anterior border of the acromioclavicular joint. So you have the patient raise the arm a little bit, and then there's a divot that forms. There's a divot behind, and then there's a divot in front. The divot in front is LI 15. The divot in back is Sanjiao 14. We'll meet that later. So classically, you have them raise the hand, you find the point, and then they can lower it down in a relaxed position, and then you needle it. And that's like if the shoulder's messed up inside, there's scar tissue, you can do some deep needling there. Put moxa on the needle. We'll show this whole procedure. The needle goes in. We use heavier gauge, a thicker needle. We work with the patient, we collaborate them. They know it's going to be some strong sensation. And we have it propped, so they can be really comfortable. It goes deep, and then you put the moxa on the end of the needle, light it on fire, put the heat lamp over it, and then if they've been alkalizing for a couple of days before that, bam, it just amazingly opens it all up. I've had patients come in, can't move the arm anymore. Been to the surgeon, and the surgeon says the only way you're going to get your arm back is if you come into surgery. But the odds aren't so great sometimes for surgery, if they're really being honest, and they're supposed to be. So I've had folks come in, and we've worked, for a month. We collaborate, and they're like, yeah, I got my arm back. I didn't have to do the surgery. So we did a combo of the 4 T's: TCM, TANs, TONGs, and Turks. For motor impairment of the upper extremities, pain in the shoulder and arm, benefits the sinews. And they say here, you can puncture it from 0.8 to 1.5, an inch and a half you can go in. And Turk would say, you can go more than that. You got to know the inner anatomy. You have to be able to visualize, like we were saying earlier. Then Li16, very nice point for moving qi and blood in the shoulder. Classic for frozen shoulder. In the upper aspect of the shoulder, in the depression between the acromial extremity and the clavicle and the scapular spine. So it's pretty much like all this bony stuff, and you keep going down closer and closer to the shoulder. The spot where, ooh, it's achy. Man. I'm going to put you to work on me. You can practice on me shortly. Because, yeah, I could benefit from that one too. It's achy. Just press it. Whoa. Feel it all in my shoulder. Also has some effects on the lungs. Descending the lung qi and benefiting the joints. It's a point on the Yang Chao channel, one of the extraordinary meridians, which we haven't popped you with yet. That's coming next. Li17, starting to get up on the neck, on the lateral side of the neck. One sun below Li18, on the posterior border of the muscle sternocleidomastoidus. Good for loss of voice. Clears the lung qi and opens up the lung. Sternocleidomastoid is the big, this stuff. Mastoid up here. Sternum, clavicular. It binds those all together. On the posterior side. Oh, yeah, feel that one. Li18 is a sun above, on the lateral side of the neck, level with the tip of the Adam's apple. Easy with me, guys like me. I'd be like trying to locate that on the ladies. I'm like, I can't find it. There's no Adam's apple there. But if you palpate, you can feel it. A little bit coming out. It's on the same level as that. Between the sternal and clavicular head of the muscle, sternocleidomastes. The sternal and the clavicular head, it's like a triangle coming up together. Ooh, yeah, I can feel that one too. Yeah. Oh. It's a window of the sky point. Very good for hiccups. Here's a weird bit. This is not going to be on any test, I assure you, but this is an Adam Moe's weirdness. I discovered, much to my dismay, if I rub this side of my face, especially when there's a little stubble, I can give myself hiccups.
Really?
Like 100%. Then later, this